Hello and welcome. Welcome again. Yes, this is Kimberly Swanson. I wanted to go over some more. I'm a licensed psychotherapist, and I wanted to talk to you all about more about this topic about anxiety. Now, there's additional number of mental health issues and medical conditions that may also include anxiety symptoms that I wanted to elaborate more on. And these symptoms are post-traumatic stress disorder, PTSD. This particular condition has you know, makes a person have anxiety after experiencing a traumatic event in their life. Like I said, these traumatic events can be from any number of life tragedies. It could be from losing a loved one. It could be an accident, some chronic health issues, or even death. Or oftentimes, this is seen with military veterans who experience some traumatic event while in the military. Uh, it can also be victims who might have suffered from a car accident. It can be a number of things, or that can cause a person to have a PTSD and experience the symptoms of anxiety. Um, Also, it's also good to know that sometimes with PTSD, anxiety can also be seen appear as anger, as well. Another type of condition, that a disorder that also has a lot of the anxiety symptoms, is major depressive disorder. These are strong relationships between, there is a strong relationship between anxiety and depression, and that's why we do use a lot of psychological tools. We use the GAD-7 and the PHQ-9 psychological tools often together, because a lot of times we see these symptoms and characteristics between these two conditions as well. Chronic disease is also another condition. It's a medical health condition, um, and it can be different type of health issues, such as chronic COPD, which is chronic obstructive pulmonary disease. Diabetes is another example that may have displayed some anxiety symptoms as well. And sometimes even high blood pressure as well is another condition. Another one is inflammatory conditions. Now, anxiety can lead to chronic inflammations and diseases such as arthritis. Just to name, one of the conditions. Another one is substance abuse disorders. Anxiety is oftentimes found in people who are trying to self-medicate and manage their mental health symptoms on their own. Another thing is chronic pain. Sometimes people have anxiety with their chronic pains and issue. You might see it because they worry about being in pain, and sometimes if they are having chronic pains and it haven't been quite diagnosed, that can be an issue. And it can also be a health issue that has been diagnosed but has not been regulated or closely monitored by a medical doctor. That can lead to having anxiety, worrying about being in pain and not having pain management, or It can be a number of things. But these are some of the things, other conditions, mental health and medical conditions that can also exhibit anxiety symptoms as well. I guess these are it for today. Peace and light. Love to hear what you all think. Till next time. Peace. Bye bye.